Internal marketing is the point of communication with patients after they have made contact with the practice. That could be entering a website, could be walking into the building, could be anything over the phone. When a patient has time on their hands to look at a Time magazine, let's say, or look at their phone, you want them to be looking at information about your practice, about your procedures, about your conditions that you treat. It's really turning your waiting room into an educational facility. And thus, they have two options. They can either look at the cell phone, or they can read about a particular procedure that they are about to talk to the physician about. The first thing you want to do when you're evaluating whether or not internal communications will be an effective part of your marketing strategy is to take a look at your practice. Take a look at the way the patients enter the practice, and what do they do when they get there? Are they fumbling around with different things? Are they asking where they're supposed to go? Are they wondering which doctor they're supposed to see? Are they wondering if they're in the right facility? All those things need to be addressed in your internal communications. Further, you want that patient to better understand their condition and better understand the resulting treatment options that they have. Internal marketing should always be consistent with the message that you have out in the public. Whether you're answering the phone in a certain manner or you're running a newspaper or television campaign, all those messages should be consistent with your website and your internal marketing message. It also builds confidence. A confident patient usually is a more satisfied patient in the end. If it's a disorganized message, or you've got paintings on the wall that don't have anything to do with ophthalmology, then you're probably losing out on a very good opportunity to paint a good picture for that patient so that they can feel at ease knowing that they're going to have a better result in the end. Generally speaking, it starts with the website. Your website should be fully organized, fully functional, fully capable of talking to all of the social marketing engines and talking to Google and Yahoo and Bing and all the search companies. From there, your message should remain consistent as you follow the patient from first point of contact all the way through to when they enter the lobby. As they enter the lobby, they should be presented with the same consistent message that they were given in the website. So if we're talking about premium lenses, and we're talking about, for instance, crystal lens, and we're saying that you can read from near, far, and up close, then you need to be able to also have that similar message internally. Then they know they're in the right place. They know that they're talking to the right people. They understand that they've not made a mistake. It's all about dropping the level of fear for patients, and that is one big component. Well, of course, you can overdo it, and that's not something that you want to do. You want to create a very pleasant environment for patients. So every single point of contact, you don't always want to be pushing that sell button. You want to have other things like nice plants and nice general artwork on the walls and things like that. But you also want to mix it in with marketing messages that really help educate that patient. Any point of marketing for ophthalmology and medical marketing really should be about education. If we can educate the patient, then we're going a long way in making their patient experience much better.